Commissioner for Health in Lagos State, Professor Akin Abayomi, has recovered from COVID-19. Following the mandatory isolation period, the commissioner retook a test which returned negative Sunday evening. In a statement by the Commissioner for Information, Bengal Motosho, Professor Abayomi's latest COVID-19 test revealed that his body system no longer secretes the virus.
Joining us now for first-hand information on his health condition is the Lagos State Commissioner for Health, Professor Akin Abayomi. Congratulations on your recovery. It was reported you were asymptomatic. How do you feel now?
Well, I feel great. I had mild symptoms. I had some body pains, headaches, sweating, but I'm very grateful that I didn't develop respiratory symptoms. So I took all my vitamins and all the medication prescribed by our doctors in Lagos State. And I gradually got better with some rest.
At what point precisely did you know that you had contracted the virus?
Well, two of my children had a mild cold on Friday. And then by the evening, one of them complained that she had lost her sense of taste and smell. So once I heard that, I suspected that she had COVID. So we all tested. We tested the whole house. And the two of the children were positive. And I certainly got a positive result as well, which explained the symptoms that developed soon after that.
So we've spoken to quite a number of people who have contracted the virus, and it's hard for many to say precisely where and when they contracted it. We know that you've been at the forefront of the fight against the virus in Lagos, and it's safe to also assume that you've been observing the safety protocols. Does this in any way imply that observing the guidelines is no guarantee of protection, especially for frontline health workers?
Well, of course, out there, you know, we practice all the standard procedures for personal protection. But, you know, you tend to relax inside your house because you don't think that COVID is going to come into your home. So I've been to all the isolation centers. I've interacted with people that are positive. I've visited patients. But if you practice standard personal protection, then you are more than likely to protect yourself. But of course, in the home, you know, you don't think it's going to come into your house. And that also reflects that the virus is still transmitting. It's still moving around the community, although we have observed in Lagos that community transmission is indeed going down.
It was earlier reported that Lagos will record over 100,000 cases by August. Lagos has only recorded a little over 18,000 as we speak. Have we outdone ourselves, or we're just lucky?
No, if you recall, I say for every one positive that we report, we probably have between 10 and 20 positives in community. So for the 18,000 that you identify, multiply that by at least 10, and you get the true figure of what we think is going on in Lagos. So our modeling is correct because we've done the maths, and we definitely think that the projection was correct. And we also projected that we would peak in August. And we certainly did that, and our data now shows that our intense sampling across the local governments is showing that we're seeing a gradual decrease in positivity every week.
Prof, are you saying that there could actually be 180,000 Lagosians carrying the virus as we speak?
Not carrying the virus, but having been exposed to the virus, contracted the virus and recovered. Remember, this is 6 months now, so you wouldn't expect 180,000 people to be ill at any one time. You know, we've observed across the state, across the local governments, that certainly, you know, there was active community transmission. It's impossible to find out exactly how many people in Lagos State contracted the virus. But with those that developed moderate symptoms, you know, who had enough reason to come and do a test, remember that majority of people who catch this virus are asymptomatic. So many people are walking around with the virus and don't even know they have it.
All right, we must say a very big thank you. One would have thought that by now you will be taking a break, but we're told you were pulled away from an official meeting. So we're very grateful for what you're doing, and we wish you the very best. Commissioner for Health in Lagos, Professor Akin Abayomi.
Thank you very much.